In the example that you're about to see, our student is going to be verbalizing their thought process during the 2-minute breakdown. In an actual MMI, you wouldn't actually be speaking during this point, but more so making mental note of what to say once your 6 minutes response time starts. If you have not seen our best practices video, we suggest stopping here and going back and watching that first so that you have a full understanding of how the MMI process works.
Should a doctor's primary aim be to change behavior to prevent disease or treat existing disease? What are your thoughts on upstream and downstream care? Okay, well, the doctor could be looking at a new or returning patient, and they'll need to assess whether the visit is a wellness check or a sick visit. The philosophy of the doctor will come into play in this situation, so the doctor may not also have a choice as to whether or not they'll be able to choose between upstream and downstream care. If they are in for a sick visit, then the doctor would need to proceed with downstream care and then take the approach of upstream care. The doctor would also need to assess the patient's barriers to care. So we could start with patient. How would the patient respond? The patient's autonomy. Would the patient follow a treatment plan or not? The regularity of the patient's visits. Are they able to do preventative care? I think I'll take the approach that they will be able to do preventative care. What things would I need to consider with regards to that? Well, for starters, insurance. This is something a doctor might want to consider, especially with regards to barriers. Does the patient have insurance? If so, is it free or not free? How available is this insurance? Would preventative care cost anything? Insurance can be limiting, especially with regards to pre-existing conditions and what insurance is able or willing to cover. It's a financial barrier. We also need to consider culture, the marginalized communities. Doctors tend to not be trusted in these communities unless it's a life-threatening situation, and this could even cause more distrust or add on more barriers on top of what we need to do for this care. We also need to consider the aspect of homeopathic and Eastern versus Western techniques.
Hey, hi, my name is Jabari.
Hi, my name is Emily Nguyen, and it's so nice to meet you.
Nice to meet you too. You can go ahead and get started.
The prompt, as I understand it, deals with whether a doctor's primary aim should be to change behavior to prevent disease or treat existing disease, and how I feel about both upstream and downstream care. The initial thought that I had was whether or not I'm a primary care physician or a specialist. I'm going to take the perspective of the primary care physician. Yes, a doctor's primary aim should be to change behavior to prevent disease. However, there are various factors involved with this that will affect the approach of each patient. Some of the factors to consider are the patient's regularity of visits, what their condition is, and how much autonomy a patient has. For example, does the patient have a guardian or are they in charge of their own care? My thoughts on this are that upstream care has a more everlasting and holistic impact on a patient. So, as a primary care physician, I'd always try to integrate this type of care. But also, I would recognize that if a patient came in for an immediate or urgent issue, then we would need to address that first, and then maybe we could implement a more upstream approach. If I'm meeting a patient once or twice a year and only when they're sick, then it would be harder to implement a preventative approach. If I'm meeting them on a consistent basis and can monitor them over time, it'd be easier to take the side of prevention. Some things that I would consider would be the barriers that my patients might be experiencing. The first thing that comes to mind is insurance. I know that a lot of insurance companies are pushing for preventative care, but not everyone can afford the premiums for insurance, even though it may be great to do a preventative care if they have the insurance, but not everyone has it. Insurance can also be limiting, especially with regards to pre-existing conditions and what an individual's policy holds. Something that helps with these conversations is that our society promotes preventative care and a healthy lifestyle, perhaps. However, as a society, we tend to be more reactionary to concerns. And there are different social and financial barriers that keep people from living this healthy lifestyle. This makes me think about marginalized communities. There's not the same access to healthy foods, gyms, time adequate living. They don't have the ability to live a healthy lifestyle. This prevents issues and makes it less practical than someone that lives in an affluent community. The barriers may be different, but for the most part, most barriers happen with lower socioeconomic communities. Also, in many marginalized communities, there's a level of mistrust between the healthcare system, especially from a social justice issue perspective and mistreatment and implicit bias. I think that the upstream approach is the best thing for a long-term health of the patient and the community. Downstream has its place. There are times when you need to treat the patient from top down. For example, if you're a cardiologist, a lot of their job is going to be focused mostly on downstream care. When feasible, I think an upstream approach is best, and the patient or doctor rapport can come into play here as well. A doctor has better rapport with a patient and may be better equipped to implement a more upstream approach. Overall, change behavior for preventative care will be the best for a healthy society and for individuals, but I understand that there are situations where this might be not feasible.
Okay, so you mentioned patient autonomy. How exactly does that play a factor in changing behavior?
A patient has the ability to make decisions on their own healthcare, on what they want to do and what they have the ability to do. So at the end of the day, what they decide is up to them. There may be barriers that they face, which I previously mentioned, such as financial and societal barriers. And as a physician, I can help alleviate or provide them resources. But at the end of the day, that might not be enough. A child may not be able to make decisions for themselves. Sometimes the elderly in a nursing home might not be able to make decisions for themselves. Therefore, it would be focusing on changing the behavior of the guardian versus changing the behavior of the patient.
So you mentioned mistreatment and implicit bias in the healthcare system. Can you elaborate on this?
I think that implicit bias is something that can be quickly seen, such as homelessness and obesity. Both of these situations, I think people have an implicit bias that these individuals are lazy or don't care. Quite often, we overlook societal barriers and maybe even bad luck that can put them in that situation. Specifically, if we look at obesity, this will tie into living a healthy lifestyle. Healthy foods are expensive, and it might be more feasible to buy fast food from McDonald's. Like, let's be real, a cheeseburger can be cheaper than a salad. I think it's important for current and future physicians to understand that these factors and barriers for patients and not take out the implicit bias in these situations or make those assumptions. And that's why we need to know that there's mistreatment and mistrust in the healthcare system.
Thank you.
Thank you so much for your time. It was a pleasure meeting you.
Likewise. So you just witnessed an excellent example of ethical question in an MMI. The purpose of these ethical questions is not to have a right answer, but to see your critical thinking skills. Life isn't in black and white, it's in shades of gray. And professional schools want to see how you operate within them. Though this was an excellent answer, the student could have addressed a plethora of factors, such as the opposing viewpoint, bringing in personal experiences to address the prompt and back up their point of view, discuss possible ramifications, or come up with solutions. In this particular prompt, the student could have addressed the following. They could have addressed a specialty. They took the approach of a primary care physician, but also mentioned a cardiologist. Here, you can expand on how cardiologists or other specialties are looking at a specific issue, which makes it harder for them to impact a patient's ability to change behavior and practice preventative care. These doctors are usually employing a downstream approach to address the immediate health concern at hand. Also, addressing insurance in more depth. The goal of preventative care is to stop small correctable issues from spiraling out of control. The larger procedures and treatments tend to come with a higher price tag, which can be a detriment to the patient, while it's also more lucrative for the insurance companies. There is a direct implication on doctors' offices and hospitals with regards to insurance companies. And because of this, a doctor may be limited in the type of approach or influence that they have on a patient's behavior and their treatment. Also, could have discussed Eastern and homeopathic medicine versus Western medicine techniques. Here, you can discuss situations where patients rely on these Eastern or homeopathic remedies as opposed to Western medicine. How might this impact your approach to the patient's healthcare plan? You could also go into more depth on the previously mentioned topics of mistrust in the medical field. Okay, just to recap, make sure to identify the players, identify what information is missing, and take note of the specific questions that are asked in the prompt. This will help you flesh out the different factors as you are giving your response. The goal is not to solve the problem, but to showcase critical thinking and other soft skills. It is okay to think out loud. You do not have enough time to compose a fully formed 4-minute answer in just 2. So think through your main points and talk it through in the station. Good luck.